Hello, I'm Dr. Kirby Thompson, licensed naturopathic doctor and acupuncturist, owner and operator of Wildflower Wellness. And today we are here for Dr. Kirby's Pick, July 2022. Man, how the time flies. I was just laying in the tub last night thinking it's almost Christmas. We have 5 months. But anyway, we haven't done this, and so our Dr. Kirby's Pick this month is Wildflower Wellness. And Wildflower Wellness is absolutely amazing. We are so grateful for all of you all who have helped us help you. And we understand at Wildflower Wellness that health is an effort. It requires persistence and consistency. We understand that everyone is different and everyone needs certain things that are the same. We call those the basics. And depending on your presentation and what you desire in your health, everyone needs something different. And the combinations of those things are very important for your health. But in medicine, in health, in healing, it's not really bam, unless it's an acute condition, But if you're looking at chronic disease, chronic problems, it's very important for you to understand that, you've exhausted all methods, and now you're going to come in, you're going to take one herb, and it's going to fix everything. That's really not reasonable. What is reasonable is that you commit. I often tell people you should start seeing results with whatever you do. But in order to get your health picture turned around, you need to invest 6 months to a year. And, often it does not take that long, but sometimes it does. It depends on if you are continually in your environment. So we help you understand how healing works. We help you by being a partner, by answering your questions, by being available through our portal for our naturopathic patients outside of office hours. We make sure that you feel supported, which is really important, especially after all this pandemic type hysteria. People really want that. People really need that. People really need to feel that. And some comfort, and I hope we give that to you. But today, we're going to go through different things that we do. And our post this month involves, what do we offer you? And I'm always looking into different services, different things, how to offer those. But also what has to be involved in that is the cost, not just to me, but to the patient. Is that going to give us any better big bangs than what we already do, because time is still a commitment in your health, of course. And remember, no matter what happens in your health, always commit. Whatever got you to the game, whatever brought you back into the game, is what you need to continue doing. And basics for health. Yes, absolutely basics for health. We offer many services here at Wildflower Wellness. The types of visits that we have are a naturopathic visit, acupuncture, and oriental medicine, facial rejuvenation, and thermography. And we use a special version of thermography called thermometry, and we use a machine called the AlphaSight 9000. It is very fabulous. So let's go into the naturopathic room and let's talk about some visits. So here is our room where we have different types of visits. The first one we discuss on our social media is naturopathic medicine. Of course, in my opinion, is the best form of medicine. On our Facebook page post, we talked about Dr. Harry Lindlar. Harry Lindlar is really important in our naturopathic thinking about health. Dr. Lindlar was actually a medical doctor, and I do recommend his books. They are quite good, and they are very relevant still today, even though they were written quite a long time ago. So Dr. Harry Lindlar recognize 3 primary causes of disease: lowered vitality, abnormal composition of blood and limb, and accumulation of waste matter, morbid matter, and poison, which, as we know about today because of huge numbers of articles, web posts, blogs, people just knowing a lot more stuff. Very relevant. Now, he also outlines how to reverse these 3 primary causes in through 6 steps, which have been affectionately termed 6 horses. Now, these are to establish normal surroundings and natural habits in accordance with nature's laws. In our clinic, when you come in for a naturopathic visit, you get a basics handout. These are pretty much his natural laws, with a couple of additions relevant for today. Number 2, economize the vital force. The naturopathic medicine is, I know, it recognizes the body has the ability to heal itself. This is because we were given a vital force. Vital force is very important, and if you don't have a vital force, then you become weak and cannot mount a response in order to heal. Now, if you're not normalizing your surroundings, then you have a bunch of junk that's keeping your vital force from normalizing because of the way you live. Lifestyle, diet, stress, things of that nature. In another guy, I think it's Giroux, I went to I was doing an online or a phone CEU, and the guy said one of the top 5 causes for disease was loveless marriages. So that's a stress, you know. And we'll go over in another Dr. Kirby's pick how stress actually can stimulate inflammatory patterns, just like, you know, chronic disease and stuff like that. Okay, so economize vital force. Number 3, build up blood on a natural basis. That is, supply the blood with its natural constituents in correct proportions. Promote the elimination of waste matter and poison without in any way injuring the human body. Some of the things that are done to promote elimination of waste actually can damage the human body. So we want to be very careful, very gentle, and I'll tell you another way to do that, which we've talked about before. Hold on. Correct mechanical lesions, that's a structure. So in naturopathic medical school, we do have adjustment classes. In Mississippi, I refer that out to the guys next door, Dr. Quinn, Dr. Gallagher, Dr. Puckett. There's a lot of people around here, great chiropractors. I love them. I appreciate them. I go to them. Thank you very much for your service. Arouse the individual in the highest possible degree to consciousness of personable accountability and the necessity of intelligent personal effort and self-help. What does that mean? That means that take ownership, responsibility for your own health. And this is one of the few branches of medicine that does that. Acupuncture, Oriental medicine does that in a way. It's like, hey, you caused this. This is what happened. Take ownership and just, you know, I'll work with you and we'll work it out together. But I love this about it. Now, in practice, we take this, and in applying this, we use the therapeutic order. And we talk about that a lot. If you do a search on our social media, you'll see the therapeutic order. And that is when somebody comes in, what do you do first? What do you do second? What do you do third? You know, that kind of thing. And of course, the highest force of medicine is chemotherapeutics, radiation, and surgery. But that's not where you start. You start down at the bottom, which is reestablish the basis of health. That is lifestyle, diet, things like that. The key is don't let it go too far. You know, if you have a symptom or if you've not been feeling well for a while, make sure you go get checked out by someone. Your health is so important. No matter what's going on around you, make sure you care for your health. I love it. I love it. This is a great branch of medicine. Now, number 2. We offer acupuncture. Acupuncture is thousands of years old, they say. I fell in love with acupuncture in Knoxville, Tennessee, and my acupuncturist's name was and still is Ward Tummins. I still refer him. He is wonderful. with his visits, his talking, his counseling, his ability to say, hey, that doesn't matter. And so, that you really want that, someone to be able to hear and understand it. And we try to do that here at Wildflower Wellness. Now, acupuncture is based on a lot of things. You take a lot of different classes about the physiology and etiology of acupuncture and how the points work and the herbs and, wind and damp. And it'll remind you of the heart attack episode of Seinfeld, one of my favorites, when they go to the holistic healer. Make sure you check that one out. In acupuncture, we have 12, where do you put the needles? We have 12 channels, organ channels. Kidney, large intestine, yada, yada, yada. Heart, small intestine. And then there's 8 extraordinary vessels, yin yama, yang yama, Rinma, Duma, and Chongma, Dama. The channels, all the points have specific indications, right? But if you're using them in a concert for a presentation, that's a totally different issue. You still have to use some of those for, symptoms and stuff. Now, people are always asking me what the difference is between acupuncture and dry needling. Dry needling is stick it where it hurts. Acupuncture, the only thing in common between acupuncture and dry needling is the device on which it's done. So in acupuncture, what we do is we listen. We take your pulse. We look at your tongue. And then we'll probably stick it where it hurts. That makes sense to get people out of pain. But what's going to make people's vital force better? What's going to help people to overcome? What's going to help people to heal? And that is giving them the points that are going to be specific for the organ systems that show up in the pulse, the tongue, or the conditions, the damp, the wind, the heat, in the pulse and the tongue, and what the patient wants in their health. That's our center, is what do you want in your health? And that's what we're working towards. Acupuncture is very wonderful. I love it. I get it. I think it's wonderful. Now, people often ask me, what is acupuncture good for? The World Health Organization also says that acupuncture can be used in addition to those many conditions for diseases, symptoms, and conditions for which therapeutic effects acupuncture has been shown. So if you've used it, you found help with it, use it for that again. Use it, do it. That's what they say, but further proof is needed. That means research, clinical-based stuff. Not clinical-based. Research-based, not clinical-based. These conditions are effectively treated as first category. It's just that more trials are necessary to establish proof scientifically. Diseases, symptoms, and conditions reporting some therapeutic effect for which acupuncture is worth trying. Diseases, symptoms, and conditions in which acupuncture may be tried, providing the practitioner has a special modern medical knowledge and adequate monitoring equipment. And if we need to route that, we can. So what does that mean? That means if you do it, if you have a condition, you want to try it, go for it. That's what it says. Now, clinically, we have the many practitioners and research studies have shown that there are many conditions for which acupuncture is good. So I'm going to go over the headings, but if you would like to, please follow us on Instagram, Facebook. This is going to be on Facebook, YouTube, and Twitter. And if you go on our social media under the post about acupuncture, what is it good for, then we will have these conditions listed specifically. Psychological, conditions of the eye, ear, nose, and throat. Neurological, gastrointestinal conditions, musculoskeletal pain, gynecological conditions, men's health, cardiovascular conditions, respiratory system conditions, preventative health, and other conditions, including medical withdrawal, addiction, adjunct care with chemotherapy and radiation, appetite suppression, rheumatoid arthritis, primary hypotension, leukopenia, postoperative pain and recovery, renal colic, obesity, skin conditions, autoimmune conditions, shingles, chronic fatigue, cold and flu. That's a lot of conditions, my friends. Bless the Lord. Okay, now, in acupuncture, we also do accessory technique. So we include that with our acupuncture visits at no extra charge, usually, unless we're in the facial rejuvenation, but that's a whole other issue. So cupping, accessory techniques, we do cupping, gua sha, and moxa. I love the gua sha. Gua sha can cause a lot of bruising, but the bruise pain relief ratio way on pain relief. Way. Now, facial rejuvenation is also acupuncture, and then we have a tab on our website called, actually these are all tabs on our website. Very small tabs, but tabs still. So facial rejuvenation, what you do is you come in and bam, we're going to cup your face. If most people think it feels pretty good. Then it's actually great. Then we're going to put a lot of needles in your face. And what is all that for? What? We're going to stimulate lymphatic and circulatory flow through the face. And also that's going to stimulate collagen growth renewal. And what you see in about 10 visits can just be, I mean, I've just seen people, I've been like, what? Who are you? Sometimes people need a few more. It just depends on your stress, your age, and your health picture, hormonal status, stuff like that. But I've seen it work really well. With our facial rejuvenation visit, we also include a full body acupuncture based on, you know, what you desire, chief complaints, stuff like that. It is very important to address people's health when they want to look young, because why do people age? Because of what's going on in their body. And some of that's just age. But remember, Caleb was 85, and he was as strong at 85 as he was at 45, and he was 85 when he conquered the nation of Hebron. I think that's what we should all strive for. Pray for. Now the other one, last but not least, so far, keep praying. I got my eye on some stuff. We have thermometry. Now, please go on our website, look under the thermometry tab, regulation thermometry. So thermometry is heat, right? Thermometer. And it's an infrared probe. And what it does is it takes the temperature of your 123 different points that are actually neurologically connected to different organ systems, different lymphatic flow channels, head, neck, chest, breast, gastrointestinal, and lower abdominal, including reproductive, and kidneys. It is absolutely fabulous. So we explain it all online. It is great if you want to actually get a picture on how your health is. If you have a condition that people are like, you're fine, that's not an issue, then, you know, this may be an option for you. Now, do you want to invest in a one-shot deal? Probably not. You know, especially depending on what we find. You always want to do a follow-up to see what's going on. And depending on what you do with your own personal responsibility and how you follow what we ask you to do are the results you're going to get. And a lot of people get great results, and we are so blessed, so grateful. We appreciate you. We thank you. And see, it goes over key organ tissue patterns, thermometry, what it's FDA approved for, and other health benefits. So we are so grateful for our people. We're so grateful for that we can do this. And if you have any questions, please give us a call and visit us online at www.wildflowerwellnessllc.com. And follow us on social media. We appreciate you.